Many Queensland doctors are refusing to budge over controversial new government contracts. Some claim the health system will end up with so few doctors it could cripple the state's public hospital services. Casey Fung reports.
The doctors on the front line of saving lives now facing a different medical emergency.
The government is forcing us down the path of mass resignation by the fact that they aren't listening and aren't prepared to act reasonably.
Last night, almost 150 doctors packed into rooms like this to discuss their response to proposed work contracts, which they see as unfair.
But they're not truly contracts in that things that are written down in them can be changed unilaterally over time.
Everyone who's unhappy with the contracts as they stand and feels that it requires further negotiations, please raise your hand.
The decision was unanimous.
We reject the contracts in their current form and who insist that the government returns to negotiations, meaningful negotiations.
If the contract stalemate isn't resolved by the end of the month, all the doctors in this room and many more across the state are ready to resign. The Health Minister is adamant doctors will be better off under the contracts.
We employ just short of 10,000 doctors in Queensland, and people will make their own individual decisions about why they wish to leave the system or not.
And he has federal backing.
To get greater productivity out of our public hospitals. I fully support that agenda.
Those on the front line are far from convinced.
This means an emergency service in complete and utter chaos.
Doctors have until the end of April to sign the contracts. Casey Fung, 10 Eyewitness News.